Good. Hello. Good morning, everyone. Well, if you're watching us live, it's good morning. And of course, depending on where you're coming from as well. Today, we are going to be talking about genitals in kids. So, what some of the problems are, what's normal, what's not, and of course, answering any questions that you have. My name is Sarah Hunstead. I'm a paediatric nurse, mum of two, and founder of CPR Kids. And as usual for a Wednesday, I am joined by the fabulous paediatrician, Dr. Deb Levy. Now, for those of you who haven't tuned in to us before, we do this every Wednesday at 10 a.m. Sydney time, because that's where we are. We are on Gadigal country, and we talk about all sorts of different child health topics. Now, Deb, for those who haven't joined us before, can you please introduce yourself?
Great. Thanks, Sarah. Yes, my name is Dr. Deb. I am a holistic pediatrician and mum to two young girls who are at school now, which is good. And yes, I work out of the eastern suburbs where I see patients privately. And when I'm not doing that, I really love educating parents and caregivers, because I know both Sarah and I feel the same, that the more you know, the less you stress and the more you can enjoy your children.
Yep, that is so true. And we often talk about and say that we are we live in so many different places now. We don't necessarily have our mums or our aunts or our grandmothers around to tell us all of that stuff. And you've got a very cranky dog in the background there.
I know. I'm just thinking both of my dogs are barking. I have two dogs. And if another dog walks past I'm at home at the moment, and if another dog walks past our house, they lose it. I mean, they're the biggest wimps. So let me just go and close the door. Give me 1 second. Okay.
No problem at all, of course. And my dog is also here because she is the CPR Kids office dog as well. So today, what we are going to be talking about, and please make sure that you, in the comments below, type in any questions that you have. We will get to them at some stage during our chat, whether it's at appropriate time during or when we have finished. We will get to those questions. We can only answer questions live, though, and we can't give specific medical advice. So just general questions is great. So, Deb, let's start. We might as well start at the younger end of the spectrum. Let's talk about newborns, and we will talk about toddlers as well. But let's think about newborns. Let's start with girls for a start.
Sure. Well, seeing that we've got 4 girls between us, that makes total sense.
Yeah, might as well. When it comes to newborn baby girls, often there are some things that we don't necessarily get told as parents that can be quite a shock or can be quite worrying. Can you run through some of those things with little girls that might be worrying to parents but are actually completely normal?
Absolutely. So when little babies are born, their genitals can be swollen, and that's for girls and boys. So for girls, their labia, which those are, I guess, just the outside of the vagina, they can be swollen. They can be a little bit discolored, almost red and gorged, bruised. It also depends. Obviously, if you've got a breech baby, there's going to be a lot more swelling in that area. So that's the first thing to comment on. The second thing is that within the first few days, they can also have a little bit of discharge from their vagina. That discharge is totally normal. Definitely check it with your healthcare provider, but it's normal because often babies will we kind of call it a mini period, but it's not.
So it looks like blood, does it? So
it's like a little bit of mucus and sometimes a bit of blood. Small amounts can happen over a few days and resolves on its own. And this is just thought to be a result of babies no longer being exposed to mom's hormones. So, I guess that's the most common thing that people go, oh my goodness, is this normal? Should I be worried? So, hopefully that reassures a lot of families out there.
Yes.
The other thing is that, and we could do a whole live on this, but sometimes, the labia, the outside lips, are actually fused.
Right.
And that's something that may or may not need urgent intervention, and that all depends on how fused, whether or not your baby's able to pass urine. But it is quite common, and in the majority of cases, it does resolve either spontaneously or just with some topical creams. But again, that's something to part of the newborn baby check, by the way, is an examination of the genitalia. So make sure that whoever's doing that does actually have a look and make sure that everything is normal, because unfortunately some babies are born with abnormal genitalia, or what we call ambiguous genitalia. It's very rare, but this is one of the reasons why that area is always examined.
Okay, excellent. And what about little boys? You've talked about, swelling to the testicles and so on. What about the presence of testicles? Can you always see or feel them when they're newborns?
Okay, so obviously babies are born with the scrotum, which is the sac, but what Sarah is alluding to is whether or not the testicles are actually down in the sac. So many boys are born when they haven't actually descended yet. That's very common, and it's something for us as practitioners to keep an eye on. So you may hear the term retractile testes. That's because it's also quite common for the testes to move down to the scrotum and then pop back up. And that's because they're on a cord and a little muscle, and that is quite common. What we need to ensure, though, is that by around about 3 to 6 months, those testes are actually down in the scrotum, because what we don't want to miss is an intra-abdominal or an undescended testes, which is sitting within the abdomen itself. The reason being that when the testicle is in the abdomen, it's exposed to the incorrect temperature. It's, because when it's in the scrotum, it's at a cooler temperature, as opposed to in the abdomen, where it's essentially at body temperature. So what that does is that actually can cause damage to that testicle, including increasing risk for malignancies down the track. So that's why we're always aware of it, always monitor for it. And if those testes aren't descended by around about that 3 to 6 month age, that's when we'll refer to a general surgeon to have a look and potentially tether those testes down into the scrotum.
Right. Okay. Very good. Is there anything else around the newborns that you want to talk about, Deb?
I think just sticking on the topic of boys, I just want to flag that erections are normal. So it can be very, very common for a newborn, even a few days old, to have a mini erection. It's nothing sexual. It's just a physiological response of the body. So don't be alarmed. Don't think that there's something bad about it or concerning. It's totally normal. The other big thing I often get asked about is foreskin. So I'm certainly not going to get into the debate about whether or not to circumcise your child. No. What I will comment on, though, is that sometimes babies are born either with abnormal foreskin, so sometimes it doesn't fully form all the way around. I'm just thinking about whether I should talk about. Let me know what you think, Sarah, and obviously listeners too, whether you want me to talk about a condition called hyperspadias, just to explain what it is. But back to the foreskin. Sometimes the foreskin isn't completely around. Usually that just becomes a cosmetic issue. But what is more common and what families are often more concerned about is when the foreskin is quite tight. So babies are born with their foreskins totally covering the head of the penis. Okay. Yes, there's an opening at the end. Sorry, that may have been a little bit unclear, but it's not typically retractile. So retractile means when the foreskin goes back over the head of the penis. That happens down the track. And so just to mention, it's totally normal for that foreskin not to retract. And it's also important as a parent not to forcibly retract it, because you will cause damage and pain. So definitely do not forcibly retract. So how do you clean your baby's genitals? As you would normally their whole body. There's nothing special you have to do. Sometimes the foreskin can be so tight that the urine gets caught, and that's you get like a little ballooning effect every time they pee. If this is happening, bring it up with your doctor and they'll chat to you more about whether or not something needs to be done. And in a small portion of children, that foreskin is excessively tight. And when they get older and the foreskin starts to retract, around about that 5-6 year, or even just pre-puberty, then you can have complications needing intervention at that point. But when they're little babies, it's quite unusual to actually need to jump in and do anything.
Yep. And I think it's a really important point there, because this is actually one of the questions that we get asked quite a bit when, in our classes, if we're talking about, other things. And that is, when cleaning, even if there's been a really pooey nappy or something, should we, really retract that foreskin? The answer is always no. It's there for protection, exactly that. You don't want to do that damage. And I love what Deb has just said about you clean their genitals as you would the rest of their body. That is just such a good and reassuring way of talking about that. And I think it's actually a really good opportunity, now that you've just been talking about, it's completely normal for babies to have erections and so on, that we really, really need to realize how normal it is for toddlers, babies, and kids, full stop, to play with their genitals, and we should never ever be shaming them for that. And that is such an important thing. And sorry, hang on. There we go. Sorry, my screen just flickered and disappeared for a second there, but we're back.
You didn't disappear for me, so the listeners would also been able to see you.
Thank goodness. Absolutely. So we need to, one of the most important things that we can do for our kids, and I am digressing a little bit here, is that we do use the proper names for genitals from the beginning, that we are never shaming or, hiding things away, that it is an open conversation, that we talk to them about their bodies and all of this kind of stuff and normalize this. Certainly I think that every generation that goes forward, we're becoming more open and more able to talk about this. And I think that's a really important thing for
100%. The reason, I was going to say the main reason really to me is around safety, and you need your child to be able to say, someone has been touching my vagina, God forbid, but, something along those lines, as opposed to feeling ashamed, not being able to discuss it with you. So I really think I 100% agree with what Sarah's saying. And from day one, we've always used it. I must say, my mother sometimes has, giggled at it when my little 3-year-old was going vagina or whatever, So like Sarah said, it's as the generations go, it becomes a little bit, the conversation becomes a little bit more open, which I think is a very good thing.
Yeah, it is very important.
Yeah. What else is it? Sorry, something popped into my head and it's just gone. As you were talking, I was thinking I'd like to mention that, but I'll think of it in a second, because I've got always something important to add.
All right. So thinking of, we've talked about newborns. When you think of it, just cut me off and jump in.
I know. It's gonna irritate me now. Yeah,
it's all right. No, just blurt it out. So we've talked about the newborns. What about getting into the toddlers? I mean, I certainly remember my two having a lot of irritation and things like that when, they were toddlers and they were able to go, ouch, vagina or gina, because they couldn't say the word.
Okay.
But what are some of the
I've remembered what I was going to say, so I'll touch on something you said, and then I'll go into that too. So I just wanted to maybe just elaborate a little bit more on what Sarah was saying about children touching their genitals. So,
please,
as she said, it is normal, and children can sometimes even masturbate for comfort. It's not a sexualized thing. Sometimes they can do it, and you'll see little girls sometimes scissoring their legs together, and I've had parents wondering if that's a seizure, and definitely this is something to chat to your doctor about. But just so that you're aware of it, is that it doesn't mean that there's any deviant type of behavior. It can just be your child's way of self-soothing. That all being said, unfortunately, I think in this day and age, we always do have to keep it in the back of your mind to say, could this child be being exposed to anything inappropriate or being harmed? So, we always have to think about it, but a lot of the time it just turns out to be part of normal behavior. I just wanted to say that. And sometimes actually I also see children, because funnily enough, I've had quite a few patients come to me with this as a concern, where it's become an increased activity. And sometimes I find it's often related to a bit of anxiety in a circumstance. So, by all means, chat to your doctor about it to try and work out the whys and if there's anything else going on. So back to what Sarah was chatting about in little girls again, with, irritation and discomfort around their vagina.
Mhm.
The two things I always will, well, actually three things, let's talk about. The three things that I think are important to consider are, one, is there a urinary tract infection? And we always need to make sure that this isn't the case. So a urinary tract infection, as for adults, will typically be dysuria, in other words, pain on urination. Urination is just a fancy word for peeing. Burning, or the need, the feeling that you need to go all the time. It's called urgency. It doesn't necessarily, you don't actually necessarily pass anything, but you feel like you need to, as plus or minus a fever. So that is your typical symptoms, and it is always important to exclude if your child is complaining of any pain, and that's done through your doctor. The other big category is something called vulvovaginitis, which essentially is inflammation of the vulva, so the outside of the vagina. It happens very commonly, especially in summertime, because kids are running around in swimming costumes. So it's not a sexually transmitted disease. It's not an infectious disease. It's usually from irritation locally. So as such, the treatment is often removal of all those irritants, so no bubble baths, switching everything to cotton underwear, making sure they're not sitting in wet undies. Often little girls have accidents. And then a topical cream to help with that your doctor can help you with. So very common and very easy to manage and treat. The third thing I just wanted to touch on is that it's not uncommon for little girls to stick things into their vagina, like a foreign body, like a piece of Lego or whatever. It's just a hole to them, like their noses or their ears. So it is not uncommon. And what would clue me to that is a discharge. So that would be what we'd call an offensive discharge classically, which would either be smelly, discolored discharge. So, if your child's got any kind of discharge in their underwear, you should be seeking medical review. But always consider that. And if your doctor hasn't, just ask, could it be a foreign body?
Yep, absolutely. And I remember talking to my girls after one of them did stick a pea in her nose and wanted to stick, those little one pieces of Lego in her ears. We talked about, you don't put things in your body, you don't put it in your nose, in your ears, only food goes in your mouth.
Exactly.
And put it in our vagina or our bottom either, because it can get stuck and we have to go to the doctors. So we talked about all of those sorts of things. And so you include every hole in the body, not just the head, when you talk about that. It is an important thing. And, being in the hospital in emergency, I have seen countless things put in different places. And even little boys putting things in their foreskin. I had that certainly happens as well, and it ends up being incredibly painful for them, and it's not something that really, you don't want that hospital visit. But certainly, speaking of penises again, what about the boys? We've talked about the vulvovaginitis in the girls, but what about the boys? Is it normal for them when they're getting a bit older to have some discharge around their penis? What happens?
Look, you can, it depends whether or not they have a foreskin. Sometimes you can certainly get some discharge coming out from underneath the foreskin, and that's just often something called smegma, which is essentially just sloughed off skin, and it's nothing to be alarmed about. What we worry about with infections, I guess, is sometimes the glands of the penis, the head of the penis can get inflamed. So that's I guess is your equivalent of the vulvovaginitis, and that it's really easy to pick because the penis becomes painful, red, and tender, plus or minus this discharge. Right. So that's something to watch out for as well. In terms of red, pain, and tenderness, the other important thing I think we should flag is testicular torsion. And that's when the testes get twisted on themselves. So the bottom line here is, if your son has a painful testicle, seek urgent review.
Yes.
You don't mess around, you don't wait, because if it is a torsion, and it might not be, but if it is a torsion, that needs to be managed urgently. Otherwise, the blood supply can be impacted and there can be long-term damage to that testicle.
Yep, absolutely. Well, for now's probably the time to ask any questions. If anybody is watching live with us now, please pop them in the comments below and we will endeavour to answer them as best that we can. And the other thing that we also love you to do is please pop in the comments below or DM us. Go to Deb's Instagram. Her handle is just, there we go. There on the screen. Make sure you go and to the Instagram page and you can DM her through there. Have a look at all of the different infographics and all sorts that are on there. So really, we want to know what you want to know so that we can bring you good information on those topics. Now, just in summary of what we've been talking about, we've talked about what's normal for newborns that sometimes you can get a little bit worried about, but is completely normal, like perhaps some bloodstained discharge, genital swelling, and so on in little girls. Certainly the swelling in boys as well. Not to retract their foreskin, so never forcibly retracting the foreskin is really important. Wash their genitals as you would any other part of their body. And of course, that it is completely normal. It is developmentally normal for your child to be touching and playing with their genitals. Please don't ever shame them for doing that, and have good open conversations and call their genitals by their proper names from the beginning. Really important. We talked about some vulvovaginitis as well and what to do about that, and some other things such as discharge from penis, testicular torsion, and so on. But we do have a question from Sarah, and Sarah has said, what would be some signs of testicular torsion when they're quite young and aren't able to communicate pain?
First of all, I want to say it's very uncommon in very young babies. So just bear that in mind. However, if in doubt, get it checked out, obviously. So, you know, any baby that's in pain is going to be uncomfortable. They're going to be crying, especially at nappy time, nappy change. And you will see one testicle will look different from the other testicle. By the way, it's actually normal for one testicle to be lower than the other one. So don't freak out and think that that's abnormal. The left one normally sits a little bit lower than the right. Sarah, correct me if I'm wrong, but I think I'm correct there. And yeah, I think I'm right. And, you know, so that's normal, but you will know. There will be crying upset, and their testicle will look different. It'll look red. The other thing to mention is that, I guess, and this is often something that Sarah will talk about, is hair tourniquets. And what's a hair tourniquet? Like, you know, I've got long hair. A lot of mums have long hair. You know, it's very easy for hair to get onto our babies. And, you know, I'm leaning down as I'm just imagining hair dropping off, especially during nappy change. And sometimes a piece of hair can actually get wrapped around either a digit, so fingers and toes, or penis. And that effectively forms a tourniquet. And that is incredibly painful. And again, you'll see it because the area past the piece of hair, so distal to the piece of hair, will be red, swollen, and tender.
Yep, absolutely. And I think that goes back to those red flags that we always talk about. If your child is inconsolable, that their behavior is different to normal, then that is a red flag for you to go, okay, there's something going on here. We need to seek medical help. Yeah, definitely. Okay. Now, another Sarah has said, is there a time that you need to retract the foreskin to clean? And that's the thing. It's, you know, it's not that you can retract it. It's that you will actually cause pain and damage if you do retract it. Deb, do you want to elaborate a little bit?
No, I agree. I think the answer to that is no. I think if you've got a non-retractile foreskin, it only becomes an issue closer to puberty, for obvious reasons. So I think my answer is you don't ever need to retract the foreskin.
Okay, excellent.
Especially not forcibly.
Yes. Absolutely. Okay. Very good. Well, I think that's probably it for today. We hope that you have found this information useful. Please share it with anybody who you think needs to know this good information. And we will see you again next week, same time, same place. And remember, make sure that you do post in the comments below what you'd like us to talk about. Okay. Thanks so much, everyone. We'll see you later.
Thanks, everyone. Have a great day. Bye.